Thanks everyone for attending this Compliance Insight presentation. This is a series of presentations. You'll see 5 of them. This is the first one, and this whole series is on FDA 483s. So what I'm going to do with this thing is go over how to prep for the FDA and getting ready for the issues that resulted in the 483 to make sure that you're in the best situation that you can possibly be in when the FDA arrives. So you asked for this information, you wanted more review of the steps involved, and therefore we're providing it. Hopefully this will be of some help to you. Now what I'm usually asked by people is, Troy, what's the best way to deal with FDA issues? And I typically respond off the top of my head is, well, you don't have any. Now that's easier said than done, because there's so many complex issues that can happen in a company. You can have a variety of things going on, and therefore it's tough not to have any 483s. The issue with it is, don't be overly cautious. There is an analysis paralysis out there. Sometimes I see people that they refuse to move forward on things because they don't want to make an error. Well, the error with that is that they don't move on things. You've got to have things done. It really is tough out there, and you have to do the best you can. This is hopefully going to help you do that. So let's start with the obvious. Did you have a previous 483, or do you have a warning letter, anything serious? If so, did you do everything to which you committed to in that response? If you did not, did you inform the FDA of the delay? You better figure that out before the FDA comes in here and finds out that you did not do what you said you would do. That is the prime cause to make the FDA very unhappy. They will not like that, and they're going to dig a bit further in there. If you're going to have further regulatory issues, that one step will certainly cause it. So make sure if you say you're going to do something, do it. Will the next audit be a general GMP audit that they come in and they're there looking at general inspections? Will it be a for-cause audit? Something that happened, a recall, a problem out in the field? Will it be a pre-approval inspection? How will all this tie in with them coming back, potentially looking at you with previous problems? If the inspection is going to be focused, you can focus your attention and get it ready for those areas. Don't forget, you could always have a general inspection, even during a pre-approval. If you haven't had a general inspection for a while, they could just couple it together. So make sure you understand what the focus of the audit will be. The facility. You break things down into the systems, and this is what I've tried to do with this presentation. Your facility should always be ready for an inspection. I hate to go in and see companies working like crazy, getting ready for an inspection, when they typically don't operate that way. That is not the way to operate in this environment. You always should be ready for an inspection. It's always a good idea to go through your facility to see how things look. Working in the factory, you can make things think in your mind that they're in control. Have someone else look at it. Have someone new take an idea of away from you to say that, yeah, you may be having real issues here. Look at it. Have new people look at it, whatever it is. Develop a tour plan for the areas. Who's going to lead the tour? Who's going to talk about it? Who's going to be the subject matter experts? Remember, the FDA can go wherever they want within reason. They can't go into the aseptic core unless you really qualify them to go in there. So you have to understand that. And there are certainly safety areas where they have to be a consideration. But really, the FDA can go anywhere they want. You just have to be ready to deal with those issues. Roll with the punches, as I used to say. Are there any signs of leaks? The ceiling, cracked walls, peeling paint, general facility problems? Are all signage in place, specifically quarantine and rejected signs? Those rejected specifically, everything in place. Is your facility registration up to date? How does the exterior of the facility appear? Do not miss the fact that people drive into your facility, they walk in the building. If it looks like crap outside, that's the first impression they get of your building, is it looks like crap. Do you really want that? And the answer should be no, you want it to look nice. Remediate anything that's possible quickly that you can. Make sure things are taken care of before the inspection happens. Key to all this is everything should look organized and in control. The big thing there is control. What's the opposite of control? Is non-control, chaos. It's terrible. You've got to look at it that way. Your process. Look at how you're making the product or your products, specifically on high-risk processes. If you're having a PAI, focus on the product and the filing. The key question here again is, are you in control? How do you know you're in control? What data indicates it? Does the process match what you filed? If you filed something with the FDA, your process should match that. If not, you have a major problem on your hand. Do the SOPs conflict with the process? These are your internal instructions saying how you're going to operate, how you're going to control your process. Is your annual product review process up to date? If I said, show me the APR for product XYZ, the last one, can you pull that out? Is it past due? Have you maintained a good change control system? And understand things change. I'm not limiting you to those changes. I'm saying you have to control them. You have to validate where necessary. You have to collect the data. You have to train people. All those things come into factor when you talk about change control. Your people. One of the most important aspects of your company is your people. Ask yourself, look into it. Are they trained? How do you know they're trained? Are they trained in the current SOPs? Are they trained in the current processes? How do you control them going out and working on something in which it may have been updated? So if I'm a manager and I assign tasks to people, how do I know those people are qualified or trained to do that task? That's a general question you've got to ask. Is annual GMP training performed? Make sure it is performed for everyone, including senior management. Don't forget those folks. How do batch records look? Look for the errors. Are there lots of errors? Are there problems with it? Are they pristine, all of them? That usually is an indication that there's something going on. Everyone makes an error. I'm not saying I'm looking for error-free. I'm just looking for lots of errors, lots of problems indicating training issues, indicating problems with instructions. They're unclear, whatever it is. Make sure that you've got that down. Do the investigation. Often cite people as the issue. If you've got in there investigation saying it's a training problem or it's a people issue, then you have a problem. You want to make sure that your people are properly trained and that the systems are in control. It's too easy to go out in investigation and say, it's the people that did this. It's not the people, it's the system. Who are the folks that you will use as SMEs, subject matter experts? Who are you going to call to talk about HVAC? Who are you going to call to talk about purified water or your WFI, whatever it is? Your process, your validation. Get those people identified, get them trained so they know how to respond, how to discuss things with the FDA. Worst issue you could have is someone that comes in, talks to the FDA like they're talking to a regular person on the line. They grumble, they talk about things they shouldn't be talking about. They really have issues in discussing with the FDA on a compliance field, the questions that will be asked of them. Make sure your SMEs are properly prepared. All the other items, and this is just sort of a quick checklist for you. You need to check everything and prep for the audit. You know your system and your company better than anyone else. you should check the areas that have potential for problems, for big impact areas. Your warehouse, your customer complaints, your validation of everything that goes on, your lab operations, your calibration, your pest and rodent control, just to name a few. You want to go through and make sure everything is in order. A key thing to look at is, just like prepping an FDA inspector does, they look at the previous EIR, the Establishment Inspection Report. Were there any noted problems that they want to follow up with? Did they have any previous 483s, warning letters, problems? You want to make sure that you follow up in those areas specifically. Again, the key to all these things are show you are in control and how you know it. If you have questions on this, if you need more information, please don't hesitate to call us. The phone number is listed right here. You can go to our website, compliance-insight.com. You can send us an email, info@compliance-insight.com. We've got a new website out there. We're constantly adding more information. There's a lot of action packages out there. There's a lot of things that you can download and get. Look for our presentations on SlideShare. Look for our presentations on YouTube. You can see all sorts of things out there that will help you out. Easiest thing for you to do, give us a call. It's simple. It's free. Believe me, I'm not evil. I'm not going to constantly badger you for business. I'm here to help. We're all here to help. You will get any one of us that are here, and they'll try to definitely steer you in the right way. So thanks for watching, and hopefully this has been very beneficial for you.